What is gynecomastia? What are the most common causes of gynecomastia? And what are the best ways to treat gynecomastia? In this video you're gonna find out. My name is Dr. Alexey Markelov. I'm a double board certified plastic surgeon. Today I wanted to talk to you about gynecomastia, or male breast enlargement. It's a common condition that's frequently seen in three groups of males: neonates, so newborn kids, because they have circulating hormones from their moms that cause their male breast glands to enlarge. The second group is teenage boys. During teenage years we have a spike in our hormone levels that causes enlargement of the breast tissue as well. And the third age is after 50 years old and older, the males get decline in their testosterone levels. That also causes some enlargement of the breast tissue. So gynecomastia is the benign enlargement of the male breast glands. Yes, we do have breast glands. They're not as large as the female breast glands, but they're present and they can be stimulated to grow with the hormones such as estrogen. So the most common causes of gynecomastia, usually hormone imbalances, and we discussed the three age categories where you see the hormone imbalances most commonly that can cause the breast enlargement. The other cause is the certain drugs, certain medications. There are certain antibiotics that can cause it, certain antipsychotic medications, and medications that can disrupt your hormonal balance and can cause enlargement of the breast glands. Certain testicular tumors, again, they cause the hormonal imbalance and they can cause enlargement of the breast glands. And in more older male population, the enlargement of the breast glands can be caused by tumor. And you as a male, you can get a breast cancer. However, it's extremely rare. There are different conditions that frequently confused with the true gynecomastia. Again, gynecomastia is just a benign enlargement of the male breast gland. What frequently confused with the gynecomastia is adipomastia or pseudogynecomastia, so it's not a real gynecomastia. And that usually happens with the enlargement of the male breast and male chest due to excessive fat. Excessive deposits of the adipose tissue of fat on the chest can look like enlargement of the breast gland, even though the breast gland is a relatively normal size. Those conditions frequently go together, the adipomastia, enlargement of the breast glands due to fat deposits, with the enlargement of the actual breast gland. And the reason for that, the adipose tissue that we have has a significant concentration of enzyme called aromatase, and that enzyme actually converts the male testosterone into estrogen, and the estrogen again promotes the growth of the breast tissue. If someone is overweight or obese, they will have more circulating aromatase in their bloodstream, and that testosterone that they have present will be converted into estrogen that can stimulate the breast gland to grow. So what are the treatments for gynecomastia? What can be done? There are certain drugs that have been described to treat gynecomastia. However, the evidence is very limited, and I know some bodybuilders who take testosterone, for example. They will take aromatase inhibitors or the drug that blocks that enzyme we talked about, the aromatase that converts testosterone to estrogen. They take that preventatively to prevent their breast glands from growing. That same drug can be used to treat gynecomastia due to hormonal imbalances. However, it has multiple side effects. The evidence is limited. The drug called tamoxifen. So the mainstream of treatment for gynecomastia is actually surgical procedure, male breast reduction. We have a separate video on this channel where you can watch the actual procedure from start to finish. But the most common procedure that I do is actually a procedure that will address both excessive fat and the actual gland. It's a combination of the awake liposuction where you extract the fat, you address that adipomastia or pseudogynecomastia portion of the male where you address the excessive fat deposits on the chest. And the second portion of the procedure is actual gland removal. Gland is very dense, it's very fibrous, it's usually like whitish tissue and cannot be extracted through a tiny little poke for the liposuction. So usually it requires a little incision at the junction of the areola, pigmented areola, and the skin, where the incision is going to be hidden, and once it heals up you can't really see it. And through that incision the actual breast gland can be removed. It's a relatively straightforward procedure with a minimal recovery time. So again, surgical procedure is usually the main way to treat the gynecomastia. I hope you find this video helpful. Please click the like button and subscribe with the button below. Thank you.